Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previous year question paper part 2. Let's start. The first question: what is the immediate first aid management of chemical accident foreign body on the cornea area? Option A: remove foreign body. Option B: cover the foreign body. Option C: clean the eyes with water or normal saline. Option D: give pain management. The correct option is option C: clean the eyes with water or normal saline. Which drug decreases the threshold of seizures? Option A: lithium. Option B: anticonvulsants. Option C: benzodiazepine. Option D: barbiturate. The correct option is option B: anticonvulsants. A type of fever in which after every 24 hours the body temperature comes to normal level is known as option A: intermittent fever, option B: continued fever, option C: remittent fever, option D: repulsing fever. The correct option is option A: intermittent fever. You're finding emulsification of fat in TPN bag. As a nurse, what is your immediate action? Option A: change the new bag. Option B: rubbing the bag. Option C: administer first. Option D: nothing to do. The correct option is option A: change the new bag. 32-week pregnant woman hospitalized with vaginal discharge and its fibronectin test positive. What kind of labor does it indicate? Option A: postpartum labor. Option B: prolonged labor. Option C: preterm labor. Option D: precipitate labor. The correct option is option C: preterm labor. Characteristic of breast cancer. Option A: non-movable fixed irregular mass. Option B: non-movable fixed regular mass. Option C: movable fixed irregular mass. Option D: movable fixed regular mass. The correct option is option A: non-movable fixed irregular mass. Which of the following drug administration during post-operative period will cause nausea and vomiting? Option A: diclofenac. Option B: paracetamol. Option C: tramadol. Option D: ondansetron. The correct option is option D: ondansetron. When is the reason to perform naloxone challenge test on the client with opioid abuse? Option A: to check reaction of drug. Option B: to check patient interest. Option C: to treat opioid abuse. Option D: to check the level of physical dependence. The correct option is option D: to check the level of physical dependence. Which of the following behavioral therapy is effective in treating patient with OCD? Option A: exposure and response prevention. Option B: aversion therapy. Option C: psychodynamic. Option D: cognitive behavioral. The correct option is option A: exposure and response prevention. The umbilical cord contains at term by option A: 2 arteries, 2 vein. Option B: 2 arteries, 1 vein. Option C: 1 arteries, 2 vein. Option D: 1 arteries, 1 vein. The correct option is option B: 2 arteries, 1 vein. Murphy sign seen in which disorder? Option A: appendicitis. Option B: cystitis. Option C: cholecystitis. Option D: renal stone. The correct option is option C: cholecystitis. The client says that his thought is being telecasted in media without his knowledge. Option A: circumstantiality. Option B: denialment. Option C: thought broadcasting. Option D: clanged association. The correct option is option C: thought broadcasting. Safest exercise advised to pregnant mother. Option A: cycling. Option B: swimming. Option C: football. Option D: racing. The correct option is option B, swimming. Name of the scale for measuring symptoms, severity of patients with schizophrenia. Option A, NRS. Option B, PANSS. Option C, VAS. Option D, FLACC. The correct option is option B, PANSS. Vacuum suction pressure in adult is option A, 120 mmHg. Option B, 170 mmHg. Option C, 80 mmHg. Option D, 60 mmHg. The correct option is option A, 120 mmHg. After thoracentesis patient to give position, option A, side lying position with unaffected side down. Option B, side lying position with affected side down. Option C, prone position. Option D, supine position. The correct option is option A, side lying position with unaffected side down. Oxytocin is mainly involved in which of the following functions? Option A, motor skills. Option B, childbirth and lactation. Option C, growth and mental ability. Option D, regulation of blood pressure. The correct option is option B, childbirth and lactation. Which of the following is not related to MMR vaccine? Option A, rubella. Option B, measles. Option C, rickets. Option D, mumps. The correct option is option C, rickets. Who among the following devised the autoclave used for sterilization? Option A, Charles Chamberlain. Option B, Robert Koch. Option C, Edward Jenner. Option D, Anton van Leeuwenhoek. The correct option is option A, Charles Chamberlain. Vidal, a serological test, is used to detect the presence of which of the following pathogenic microorganism? Option A, E. coli. Option B, Mycobacterium tuberculosis. Option C, Haemophilus influenza. Option D, Salmonella typhi. The correct option is option D, Salmonella typhi. Please like and subscribe. Thank you.